checkups. All right, well, I started the recording. So, hello, I'm Preston. I'm going to be doing my faculty checkoff for head to toe. This is my patient, Danielle. I have provided privacy as well as washed my hands with soap and water. So let's begin with vital signs. The purpose of this assessment is to assess just about everything and everything we've learned this semester as well. So, Danielle, is it okay if I perform a head-to-toe assessment on you today?
Yes.
Okay, perfect. Let's begin with vital signs. Let's grab our blood pressure cuff. Do you have a preference for what arm?
No.
Okay, have you had your blood pressure taken before?
Yes.
Okay, I'm gonna get this cuff on there and let's begin by, well, that ain't going right. Does that feel okay?
Yep.
Okay. So let's begin by approximating. Just relax. I'm gonna approximate by palpating her radial. I should probably get my. Already off to a slow start. Okay, I stopped filling it around 130. So I'm going to pump it up to 150, give her arm a second, make sure all the air's out. Okay. All right, Danielle, you ready?
Mm-hmm.
Okay, I'm at 150. Okay, 130 over 90, good. Alright.
Just walked up the stairs.
I know, you're fine. You just worked out, right?
Yeah.
Okay. Alright, let's do your pulse next. Let's count your pulse. Let me start my timer. Okay. Okay, that was 35 beats in 30 seconds. That's going to be 70 beats per minute. Temperature, I don't have a temperature gauge. I cannot assess her temperature. So next I will do respirations. So Danielle, just do your best to breathe normal, okay? I'm going to count your respirations. Okay, that was 7 respirations in 30 seconds. So that was 14 respirations per minute. Next, let's begin by assessing her mental status. I feel like I'm forgetting something on vitals. All right, let's go to mental status. Danielle, can you tell me where you're at right now?
In your bedroom.
Okay. Can you tell me what day of the week it is?
Thursday.
What about the time of the day?
5.
Okay, yeah, I'm pretty sure it's pretty close to 5. Okay. So she is oriented to person, place, and time. She knows where she's at. Next, I'm going to give you 3 words. I'm going to later ask you what these 3 words are towards the end of the assessment, okay? Blanket, shoes, dog. Do I need to repeat them?
No.
Okay, good. So next we're going to be going to skin. So I will begin by palpating texture, temperature, as well as moisture. Gotta get it together. All right. So let's go temperature of all extremities. Good. She is warm, dry, and smooth. And my buzzwords there. Good. And we're also going to be assessing her skin throughout the entire assessment. So next portion, I want to be assessing her turgor on her clavicle. So see if we see any tenting. No tenting present. Next, I'm going to be doing a CMS check on all her extremities. So let's see her fingers. Good, they're not painted. So let's check capillary refill. It looks like about 2 seconds. Just check it bilaterally. Okay, good. Less than 2 seconds. We would typically do her toes as well to check her lower extremities. Toenails are painted, so I will not be able to see the capillary refill. So next, let's go with your face. So let's assess it for symmetry. Great smile, looks good. Skin, everything looks good. Face is symmetrical, like I mentioned. Cranial nerves. So let's do cranial nerve 7, which is face tricks. So Danielle, can you blow out your cheeks for me? Can you raise your eyebrows? Can you stick out your tongue? Good. Can you say ah? Okay, good. Also, let's do cranial nerve 5, which is the cotton ball test, to see when she feels it. So let's grab our cotton ball. So I'm going to have you close your eyes, Danielle, and I'm going to touch your face with the cotton ball. Tell me when you feel me touch your face, okay?
Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, good. So she felt that. So cranial nerve 5 is intact. Next, we're going to move to eyes. So the first part of that is the Rosenbaum chart. I do not have access to one of those, and that would be testing her acuity. So next, let's just inspect her eyes. Okay, Danielle, just open wide for me. I'm sorry, yeah, your eyes. Open your eyes wide for me. Okay, good. Eyes are white. Let's check reactivity. Let's try to at least. Okay, eyes are round and reactive bilaterally. Okay, good. So we're assessing her sclera, her pupils, for any conjunctiva. I hope I said that right. Next, let's do our whisker test. So the first one assessed cranial nerve 3, 4, and 6. Or no, this one will assess 3, 4, and 6. The first one I did with Perla was 2 and 3. So let's do our whiskers. So Danielle, just follow my light, okay? Without moving your head, just move your eyes. Good, okay. Cranial nerve 3, 4, and 6 were intact. Next, I will test her peripheral vision for cranial nerve 2. So Danielle, just have you look straight forward, just look over my shoulder, okay? And tell me when you see my fingers.
See it. See it. See it.
Okay, good. So cranial nerve 2 was intact when I checked her peripheral vision. Next is going to be ears, so let's inspect her ears. Good, you got your hair back for me, perfect. I'm checking for any lesions, masses. Danielle, tell me if you feel any discomfort, okay? Okay, so I kind of combine my inspection and my palpation together. Okay, good. So we will test cranial nerve 8 now, which is going to be our whisper test. So Danielle, I'm going to whisper a word in your ear, and you're going to tell me what you hear, okay?
Dog hot.
Perfect, thank you.
Scrunchy.
Okay, good. Cranial nerve 8 is intact. Next, we will move to her nose and sinuses. So we'll begin by just inspecting them. Then we'll, from there, we will palpate and percuss. So good. It is symmetrical. I'll begin. Now I'm going to touch your face, okay, Danielle? I know this is really going to bother you. Tell me if you feel any discomfort. Okay, good. Next, I am going to percuss her maxillary and frontal sinuses. So Danielle, I'm going to tap on your face. Tell me if you feel any discomfort. Any discomfort?
No.
Okay, good. We would also test cranial nerve number 1, which we would do smell. I don't have any vials of anything for her to smell or anything like that, so we're going to skip over that one. Next is going to be her mouth and pharynx, so we will inspect her mouth first. So will you open your mouth for me, Danielle? Okay, I'm looking at her gums, her teeth. Will you lift up your tongue for me? Okay, good. I see no lesions or masses. You can put your tongue down for me. Will you say ah? Okay, good. I tested cranial nerve 9 and 10 for ah. Cranial nerve, yes, 9 and 10 for ah. I'm pretty sure it's 9 and 10 for ah. Next will be cranial nerve 12. That's where I would have her do tongue tricks. So Danielle, can you roll your tongue for me? Okay, good. Cranial nerve 12 was intact. She performed tongue tricks. Next is going to be neck. So we're going to inspect the neck. So we're going to palpate your lymph nodes, see if we feel any lymph nodes. Good. I feel no swollen lymph nodes. And just inspecting, it is symmetrical. So next, I'm going to test her cranial nerve number 11, which would be me pushing, or well, just having my hand against her head, and she's going to push against it. That's going to be her sternomastoid. So Danielle, I'm going to put my hand against your head, and you're going to push against it, okay? Okay, good. Let's do the other one. Okay, good. Now we're going to test her trapezius. So will you lift up your shoulders? Good. Cranial nerve 11 was intact. Next, we'll do range of motion for her neck. Danielle, can you put your head forward? Can you go back, to the left, to the right? Then we make a circle. Did you feel any discomfort with that?
No.
Okay, good. Next, we're going to be doing her thorax. We'll begin with the posterior. So let's have you stand up right here for me, Danielle. Let's make sure. Okay, good. Okay, we have to pull up your shirt, okay? So we'll begin by inspecting, seeing, looks symmetrical. I see no masses, no lesions. So this is also part of the kind of like the skin assessment. I'm assessing to see her skin, how it looks. I see no blanching, no redness. So inspection. So now I will palpate. Just work my way down with both hands. I'm gonna go back up. Danielle, tell me if did you feel any discomfort?
No.
Okay, good. Next, I will percuss. And I'm doing direct percussion. Okay, good. Next, we will auscultate 7 locations bilaterally. You're doing great, Danielle. Thank you. All right, when I touch your back with the stethoscope, will you take a deep breath, okay? Good. I heard no crackles or wheezes. I almost forgot, during palpation, I'm also going to do tactile phrebetus. So Danielle, every time I touch your back, say 99, okay?
99, 99, 99, 99.
Vibrations were felt throughout all the way to the bottom. Also, I'm going to do lung expansion. So let's take a big deep breath for me. Okay, good. And lungs did expand. Also, I will do the costal vertebral angle test to assess her kidney, see if she has any kidney pain. So Danielle, I'm going to whack your back, okay? Tell me if you feel any discomfort.
No.
Okay, let's do the other side.
No.
Okay, good. Now we will move to her anterior thorax. So Danielle, kind of just spin around for me. And then pull up the front of your shirt if you don't mind. And we will auscultate 7 sides bilaterally, the same as the last side. And then just take a big deep breath for me. Okay, good. We assess the 7 sites bilaterally. Next, we are going to move to the cardiovascular portion of the assessment. So I will need my patient to lay down at 30 degrees. It's the best part. All right. So let's begin by palpating her carotid arteries. One at a time, assessing symmetry and rate. Okay, good. Her carotid, it was symmetrical when I was palpating. Next, I'm going to, let's see, her pericardium, for any thrills or heaves. So Daniel, you actually pull up a shirt from you. Thank you. Okay, I'm assessing for thrills or heaves. Okay, no thrills or heaves assessed. Next, I will auscultate the heart, going in the ape demand pattern. So I'm going to be getting on the right side, second cloud. Oh, what's it cloud space. Oh, that's going to bother me now that I can't remember it. I've drawn a blank, but it's going to be the second one. Okay, we're going ape demand. So we're beginning with the aortic, pulmonic, good. Herbs point down at the third space. We're going tricuspid at the sternal border. Then we're going mitral at the apex. Okay, good. I just had the word. I just had it again. Second, intercostal space. That is the word I was looking for, is intercostal space. So next is her abdomen. You can pull that. Or let's have it about right there. Okay, perfect. So I'm assessing her abdomen. I'm going to begin by looking at her umbilicus. It is midline. Will you do a crunch for me? Okay, good. I see no herniation. So next I'm going to be doing, I'm going to auscultate for bowel sounds in all 4 quadrants. So let's begin with the right upper quadrant. And we would auscultate for 5 minutes. Good. I hear clicks and gurgles at about 15 to 30 per minute. Left upper quadrant. Good. Clicks and gurgles. We're going left lower quadrant. Good. Right lower quadrant. Good. Clicks and gurgles heard. So I inspected to see for any lesions. Then I did auscultation. Then palpation. So let's palpate. No giggles from the patient. That's good. Okay. And actually, before that, I should have done percussion. So let's percuss. Okay, I'm coming back to left lower quadrant. Now I'm at right lower quadrant. Good. Tympany throughout, right upper quadrant. I did hear some dull. We're going to assume that would most likely be her liver. So next, peripheral vascular. So Danielle, you can stay right there for me. That's fine. So I'm going to assess your pulses bilaterally. So let's actually begin with the brachial on her right arm. Okay, good. Other arm. Okay, good. They are even. Symmetrical, even rate. Let's do radial now. Okay, good. Other one. Let's hope we're moving at a good pace because I don't leave the timer on. Okay, good. And then we have 2 more by the feet. Let's do the post-tibial first. And we will find the medial landmark right here and assess and not push too hard. I can see it. I do feel it's very faint. But your feet are warm, so we know you're getting circulation. Assessing bilaterally. Okay, good. Now we'll have the dorsalis pedis. We'll kind of run along just the big toe line right here. Assessing. Okay, it is also very faint, but we do feel it. Assessing the other side. Okay, good. They are even. So next we're going to move to lower extremities. So perfect. You're already laying down. So I'm going to inspect her extremities, her lower extremities, for any masses, any lesions. I do not see any. So let's begin with the range of movement tests for, let's do your hips. So will you swing your right leg out towards me? Okay, good. Will you put it in for me? Okay, will you do the same thing with your left? Okay, good. Will you raise one leg? Okay, good. Put it down. Raise the other leg. Okay, good. Good range of motion. Did you feel any discomfort with that? Okay, good. Next, let's do her knees. So Danielle, will you just bend your knee for me one at a time? Then straighten it. Good. Other knee. Good. Okay. Now let's do her feet. Will you point your toes towards the ground? There we go. Now up. Okay, will you do the same thing? Now up. Okay, good. Strength is intact. Also, I'll have her test her toes. So Danielle, will you bend your toes for me? Okay, now just point them out. Okay, good. Let's see. Bend your knee for me. Now straighten your leg. Okay, good. Same thing with this one. Now straighten your leg. Good. Strength was also intact in her knees. So now we're going to move to musculoskeletal upper extremities. So Danielle, will you come sit here at the edge of the bed for me? Okay. So let's begin by inspecting. Okay, we're inspecting. I see no masses. Tell me if you feel any pain. You know, let's have you stand up. Let's have you stand up just like how we did that other one, okay? So just stand up right here and face the camera. Good. So we inspected and we palpated already. Next, we're going to move to our range of motion test. So let's start with the shoulders. Will you raise your arms out like that? Good. Will you go forward? All the way up to your head, back down. Will you comb your hair? Other arm. Okay, good. All right. Arms out like this. Are you flipping? Okay, good. Elbows. Bring them in. Back out. Do the same thing. Okay, same thing. Okay, strength was intact. Okay, let's do your wrist now. Go up, go down, go in, go out. Okay, good. Fingers. Go like that with your fingers. Okay. Spread them, put them together. Okay, good. Can you squeeze my fingers? Strength was definitely intact. Next, we're going to do neurological. So we're going to be inspecting her body position. She's upright, no tremors, anything like that. Deep tendon reflexes. I believe according to the page, it's either the Achilles or patella. Either way, I don't have it. I don't have a reflex hammer. Normal finding would be 2+, and it ranges from 0 to 5+. Next is your sensory. So let's have you sit down right here, Danielle.
This way?
No, face the camera. All right, so this is going to be the light and sharp pain test. So we're going to make sure she can differentiate between soft and sharp. Okay, Danielle. So I'm going to have you stick out your hands like this. I'm going to either touch you with a dull or a sharp. And with your eyes closed, you're going to tell me which one you feel, okay? All right. Okay, I can see.
Just say softer.
Just say soft or sharp. Okay.
Soft. Sharp. Sharp.
Okay, let's move to the other hand. Okay, begin.
Soft. Sharp. 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 Soft.
Okay, let's do your feet now. So also don't look. I guess the camera doesn't see it.
Soft. Sharp. Sharp.
Okay, other foot.
Sharp. Sharp. Sharp.
Okay, good. Patient accurately reported all of those. So normal finding there. Next we will do, normally we do the tuning fork. I don't have a tuning fork, but I would, I would put that on her distal index knuckle on both sides, so bilaterally. And I would also be doing it on both big toes. And that would be assessing her superficial sensation to make sure she can feel the vibrations of the tuning fork. Danielle, can you tell me what those 3 words were that I...
Blanket, shoes, computer.
Okay, patient accurately reported 2 of the 3. The third one she was looking for was dog.
Dog.
I'm like 90% sure it was dog. I know it wasn't computer. All right, Danielle, let's have you stand up. Can you walk to that side of the room for me? Okay, good. So I assessed her gait. It is intact, normal swing of the hips. Now will you do let's do heel to toe walk to the other side. Okay, good. Patient had good balance. Well, that's not seeing anything. That's all right. All right, let's do, now I will do the Romberg test. So Danielle, let's come stand right here for me. So with your eyes closed, you're just gonna stand there. It's the easiest test you'll do. I'm providing patient safety. I would do this for 30 seconds. Okay, patient is standing normal. They're not swaying, they're not falling. I'm not having to catch them. Good, Danielle. All right, and then the last one, there's one more. Finger to nose. With your eyes closed, you're gonna touch your nose with your index finger one at a time. Okay, good. That showed accuracy of movement, which it was intact. And I believe that concludes our head to toe assessment. Thanks, Danielle, and thanks for whoever's watching.